So we're going to be operating today on a gentleman who's 75 years old. He's had bilateral cataracts. He's had one cataract already removed. He's had a multifocal Restore intraocular lens placed, and after surgery was able to see nearly 20/20 in the eye we operated on and be able to read fine newspaper print without his glasses. Now, because of the imbalance between the two eyes, he's having his second cataract done. We'll be putting in an identical type of lens that will give him near and distance vision, and I'll be making a little incision to correct for his astigmatism at the same time so that we can improve his distance vision even more so as a result of correcting his astigmatism as well. So with that, he will have good vision in both eyes, be independent of glasses for distance, be independent for glasses for all of his close work. He's an avid golfer, he's an avid reader. This is something that really has improved his life immensely since we did the first eye, and I imagine it'll be even twofold when we do the second.
Well, I've noticed within this past year that I was starting to lose both distance and well as trying to read. Even with I kept increasing the intensity of the magnification of reading glasses, and also I started to notice a little bit of a grayness or fuzziness in my vision, which I knew I'd had a slight cataract several years back, but it wasn't progressing very fast. So, but this year it took a complete turnaround. Went really bad. Since I've had my surgery, it was about approximately 2 weeks ago on the first eye, and with the new lens, I've found that the big difference in the ability. I couldn't believe it in just 2 weeks that I was able to really start seeing road signs when I'm driving, and also be able to read fine print in magazines, and so which was great, not to have to look for my glasses again. Amazing when you can finally see what's happening where your ball is going. You know what you have to do out there to make it a lot easier to make those corrections without having to go take a couple more lessons. So that's what I really, in fact, I just golfed yesterday, and it was really fun to be able to even watch not only my own ball, but my buddies that I was playing with were amazed at how I could finally see the ball. One of the things that in my apprehension was the fact that I'd probably be having a lot of pain during surgery and afterwards, and I was very pleased because I really had no pain whatsoever, and that was just great. I walked away and hardly knew that they had even done any surgery in my eye at all. Looking forward to having my session today and fixing up the second eye, and again with the same great results.
Okay, you can take a photo. That's it. Joe, you did great. Everything went perfect.
Good, thank you.
Not so bad, right?
Oh,
okay. I think you got a little snooze in during that.
I was relaxed.
Everything went just great. Good job. This is a typical cataract procedure. It lasts somewhere in the neighborhood of about 15 minutes to maybe 20 minutes, depending on some of the measurements that we took. The patient is really very comfortable during the entire procedure. They got a little sedation just to make them a little bit drowsy, but they're certainly wide awake during the procedure. And now that this procedure is done, they can sit up right away. They can have something to eat right away. They actually, as you see, he's coming out through the door right now with a smile on his face, and there gives you the thumbs up. And he'll be able to go home and really resume pretty much normal activity. Most of my patients drive themselves to the office the next day. Certainly of those people who are very active and want to exercise, play golf, walk, ride a stationary bicycle, ride a regular bicycle for that matter, they can really do all of those activities right away. Probably the only restrictions that we ask of patients is not to swim or to go into hot tubs simply because of the water and the potential for an infection. But they'll be on a couple of different eye drops that they'll use for about 2 or 3 weeks. And at the end of that time, I usually don't have to see my patients back again after that period of time for about a year, and then just yearly visits thereafter. So it's a pretty easy process for them to go through without significant interruption at all in their normal daily lifestyle routine that they have, and they can resume that right away.
Well, Connie finally convinced me that being I was in need, I found out about a month ago, to have cataract surgery, that I ought to consider putting in the new lens, and so that I would not have to have glasses, either for distance or for close-up. And so 2 weeks ago I had my first eye done, and everything turned out great. And then yesterday I had my second eye done. This morning when I got up, I went out, grabbed the newspaper, and I found out I was able to read the newspaper already without glasses. And I was able to drive myself all the way over here with no problem with vision. So I'm extremely pleased the way it's turning out.